Hello. In this faculty development series, we will focus on writing quality narrative evaluations. While this development video is framed through the lens of undergraduate medical education, specifically working with medical students at the clinical level, the topics discussed are also applicable to working with trainees at the graduate medical education level as well. Looking at the ACGME clinician educator competencies, this development will touch on the competencies of universal pillars, diversity, equity, and inclusion in the learning environment, as well as educational theory and practice. Before discussing how to write a quality narrative evaluation, we must first explore a bit of the why when it comes to narrative evaluations. A recent survey of program directors across specialties noted that the Medical Student Performance Evaluation, or MSPE, which is largely constructed from written narrative evaluations, is consistently rated as one of the top factors in deciding whom to interview and whom to rank for residency. So what makes for a quality narrative evaluation? Well, a quality written narrative evaluation will be one that comments on performance and which is rooted in observed behaviors. This narrative should focus on the trainee's strengths as well as opportunities and areas for growth. A quality narrative will have a specificity of comments. While providing evidence is good, it's even better to use examples. Quality narrative will also be useful to its audience, both to the students receiving the written evaluation, as well as to program leadership responsible for evaluating the trainee's performance. Quality narrative will also be of an appropriate length, neither too long nor too short. A good rule of thumb is to aim for a single paragraph of about 5 sentences, focused on 3 major competencies. A quality narrative will also be submitted in a timely fashion, as studies show that narrative quality actually directly correlates with the length of time elapsed between working with a trainee and writing the evaluation. Finally, a quality narrative will be one that is competency-based, and the comments written should always match with the numerical score if a rubric is being used. To better summarize these characteristics, I've developed a framework that I call the 3 B's of better narratives. Write a quality written narrative evaluation. The narrative should be rooted in observed behaviors, should mitigate bias, and should build up the trainee. When writing about observed behaviors, it's important to be specific. I recommend that evaluators always show their work. Evaluators should be incredibly careful when using particular adjectives and should always avoid code words such as outstanding or excellent. While it is helpful to provide evidence when discussing observed behaviors, it's even better to show examples. Finally, these observed behaviors should always be used in a competency-based approach. Let's look at ways to add specificity to the comments written in an evaluation. If we take a single qualifier, such as competent, which has variable meaning depending on the evaluator, we can improve this by saying that the student took thorough histories and exams that were focused. An even better way to write this would be to say that the student demonstrated excellent clinical judgment and quickly recognized the patient's worsening respiratory status while taking the history and notified the team immediately. Looking at another common example, such as hard worker, it would be better to write that the patient is a team player, always helping out with tasks that needed to get done. The best way to frame this would be to use specific examples, such as Katie took the time to make a phone call to a transferring hospital to obtain much needed records for the team. This shows Katie's commitment both to her patient and to the team. When discussing observed behaviors, it's important to use a competency-based approach. This slide demonstrates the 6 core competencies from the ACGME. And it is from these 6 core competencies that the David Geffen School of Medicine at UCLA has developed their own 13 subcompetencies for evaluating medical students. Let's look at a few examples of using a competency-based approach. Written below is an example of something that might be found in a typical evaluation for a student. Tina possesses a superior fund of knowledge, above that seen in most clerkship students. While there's nothing inherently wrong with that evaluation, it really only addresses one core competency, medical knowledge. A better way to write this evaluation would include the following. Tina demonstrated an ability to apply her deep understanding of physiology and basic science to new clinical problems. This was demonstrated by her ability to formulate appropriate prioritized differential diagnoses and propose sensible steps in narrowing the diagnosis and developing a therapy plan. For one patient, she discussed complicated drug adverse effects and interactions that I had not considered in the differential. By including a paragraph of Tina's observed behaviors, we've hit on three competencies: medical knowledge, patient care, and practice-based learning, and provided a much more robust evaluation. The second B in our framework stands for mitigating bias. It's important to recognize that any written evaluation is subject and prone to bias. Looking at some examples, in one study of applicants to residency programs, it was noted that white and male applicants were frequently described as exceptional or intelligent, whereas underrepresented minorities were described solely as competent. Female applicants were much more likely to be described based on personality traits such as pleasant, lovely, and compassionate. In a similar study, looking at written evaluations of clerkship students, male students were much more likely to be described as respectful and scientific, whereas female students received comments on personality traits such as lovely, warm, and poised. The same study compared the words used to describe non-URM students and URM students and found quite a discrepancy in the words used in written evaluations. Other forms of bias that may be introduced into the narrative include things such as doubt raising. He appears to be motivated. Or faint praise. She is better than average. Or career trajectory bias. Examples of this would include having non-URM students described as researchers and professionals, whereas URM students are merely described as students. The third B in our framework stands for building up the trainee. It's important that the written narrative evaluation tell the trainee what they did well. It is equally important that the written narrative evaluation tell them how they can improve. Finally, it's imperative that the narrative should always mirror exactly the in-person feedback given during in-person conversations. Let's look at an example. Rather than writing her history-taking skills improved, a better narrative would expand to say she asked for help with her sexual history-taking skills and after direct observation quickly responded to feedback on how to improve. This shows not only that the student improved in a specific skill, but also shows her commitment to seeking out and applying feedback. Finally, at the end of any written narrative evaluation, it's important to take a time out and make sure that all three Bs are addressed. In fact, for those working at the David Geffen School of Medicine, our written narrative evaluation for students actually provides a timeout in each evaluation. Those filling out the evaluation will actually be asked, did you provide feedback that is specific, constructive, and actionable? Or did you build the trainee up? Did you avoid comments about character traits and personality and instead focus on behavior? Is the evaluation rooted in observed behaviors? Finally, did you reread and edit as needed for language that may suggest an unconscious bias? Did you work to mitigate bias? In conclusion, I hope that you will find this framework helpful as you go to write written narrative evaluations. Using the three Bs can help provide a standard, structured approach, which can make the task much less onerous and much more standardized. When writing a written narrative evaluation, make sure that the evaluation is rooted in observed behaviors. Be specific and competency-based, and write a small paragraph. After you've written the evaluation, work to mitigate the bias. Use a timeout to reread the comments and be mindful of the language used. Finally, make sure that the narrative evaluation builds that trainee up. Tell them specifically both what they're doing well and how they can continue to improve. Thank you very much for watching this faculty development series. I hope that you found it useful.